Hey, good morning, everyone. This is your wound and lymphedema bro, and it's Sunday morning. I would like to talk about have you ever experienced doing a dressing change and the wound just keeps bleeding? So, what you're gonna do if that happens? So, you're doing a dressing change, and all of a sudden your wound starts oozing with a sanguineous drainage, or it's bleeding. Period. So, the first thing that you would do is to help the formation of what we call the platelet plug. So that's a formation of blood clot outside of the blood vessel um, to seal that capillary or that small blood vessel that's causing the bleeding. So to support that, you're gonna get a gauze and you're gonna press onto the side of bleeding. You put a little bit of pressure, and it has to be between 3 to 5 minutes. Did you hear that? It's between 3 to 5 minutes. You're not gonna press and then look at it again, press it again. You're not gonna form a plug, a plated plug. If that's your strategy, you have to just do this, and you just to wait. Patience is a virtue. You just have to wait 3 minutes, and most of the time it will stop. Okay, what happens if it does not stop? What is your next step in management? Your next step will be if you have a calcium alginate, you have to cut a piece of calcium alginate, and because of its hemostatic property, you're just gonna put it on the side of bleeding and put a little bit of pressure again, and usually it will stop. However, what if it will not stop? So what you're gonna do is you're gonna reach for your big gun, which is your silver nitrate. So you're gonna look for the reach for the silver nitrate and apply it on the focal point of bleeding, and most of the time it will stop. By the way, so what are the reasons why the wound bleeds during dressing change? When you are first and foremost, always remember that the process of healing starts with granulation tissue formation. You want to form granulation tissue to fill in the gap, right? So this process is through what we call angiogenesis, which is a formation of new blood vessels. So the granulation tissue is actually a meshwork of new blood vessels, okay, or new capillary beds, and that's the reason why the color is beefy red, because it has a lot of endothelial cells, or you have a lot of it is just blood vessel, period. And of course blood vessel has cells on it. So, and it's very, you can easily rip it off and it would bleed, especially if you are not using the right dressing. So I suggest that if your wound has entered the granulation phase, meaning to say that it's now started to proliferate, or is now on the proliferative phase of healing, I suggest that you use a contact layer. Okay, number one, what are these contact layers? Say for example, you have your Seroform, Adaptic, which is my favorite. Number three, you have the Curity Mesh. Those are the locally available contact layers that we could use. Now, the other cause of bleeding is just a trauma to the wound. So, say for example, there's not a lot of granulation tissue, but all of a sudden you just see that wound spurting like that. Usually it's trauma to a local capillary, or it's like small blood vessels in the area. So what you're gonna do is do the same process again. Okay, so anyway, you need to be careful. Make sure that when your patient is anticoagulated, even taking, in my experience, even people who takes baby aspirin, especially if they take that twice a day, they can easily bleed. So you have to be very, very careful in doing dressing change. So make sure that you could always moisten the dressing before you remove it, so that's going to be less traumatic to the wound base. Okay, so if you have any questions, please feel free to comment and wait for my next blog. Thank you very much, and go heal the world.